Safety Work Group will now begin.
Good afternoon, everyone. Welcome to this virtual meeting of the Charter Commission's Public Safety Work Group. This meeting includes the remote participation of members as authorized under Minnesota Statute Section 13D.021 due to the declared local health pandemic. For the record, my name is Tony Newborn, and I am one of the co-chairs of the Charter Commission's Public Safety Work Group. Commissioner Andrea Rubenstein is our other co-chair. I will now call this meeting to order and ask the clerk to call the roll so that we may verify the presence of a quorum.
Commissioner Kozak.
Here.
Commissioner Perry.
Here.
Commissioner Sandberg.
Here.
Commissioner Schwarzkopf.
Present.
Chair Clegg.
Here.
Commissioner Rubenstein.
Here.
Commissioner Newborn.
Here.
There are 7 members present.
Great. Thank you. Let the record reflect we have a quorum. We will now proceed to our agenda, a copy of which was posted for public access to the city's legislative information management system, which is available at lims.minneapolismn.gov. And now we will move to adoption of the agenda. Commissioners, the agenda for today's meeting is before us. May I please have a motion to adopt the agenda?
Sandberg, so moved.
Is there a second?
Second.
Perry, second.
Great. Is there any discussion before the clerk calls the roll? With that, seeing none, I'll ask the clerk to call the roll on the motion.
Commissioner Kozak.
Aye.
Commissioner Perry.
Aye.
Commissioner Sandberg.
Aye.
Commissioner Schwarzkopf.
Aye.
Chair Clegg.
Aye.
Commissioner Rubenstein.
Aye.
Commissioner Newborn.
Aye.
There are 7 ayes.
Great. That motion passes and the agenda is now adopted. Item 1 on the agenda is the chair's report. Commissioner and Chair Rubenstein, would you like to provide the chair's report?
Actually, I don't have much of a report, Commissioner Newborn. As you all, I'm sure know, we have prepared a work plan and we sent it to everyone, and it has a schedule going forward to the end of November. And so we'll be following that work plan each week for the agendas of our meetings. So that's really all we have for the chair's report, except for item number 2, which in a way is also a part of the chair's report. And so I will, well, before I move on to that, are there any questions or discussions on the work plan? Hearing none, I will move on to item 2 of the agenda, which is reviewing and discussing interim recommendations for the full Charter Commission. This item is meant to
Apologies for interrupting, but just as a point of personal privilege, is there any way that you can be closer to the microphone, Commissioner? It's difficult to hear you.
Is
Sorry.
this better?
A little bit.
Okay. Unfortunately not. I've been having trouble with my computer all of a sudden, but I'll do my best. Item 2 on our agenda is reviewing and discussing interim recommendations for the full commission. And we raised this as a brief, I hope a brief housekeeping item, but with apologies to our guests, we put it early on the agenda because it is so essential to our work going forward. The first matter has to do with the standards that we would like to follow in reviewing proposed amendments. you all received a draft setting out the 6 standards or tests that were outlined by Chair Clegg and which we discussed last week. Added to those 6 standards or tests, the draft also contains notes and comments that primarily reflect discussion of the standards in the work group meeting last week. And I also added some legal citations where that was appropriate. If I'm correct, I believe that we've already had consensus on these standards. And so I would just like to propose that as a work group, we adopt the draft as a recommendation to the full commission at the upcoming September 2nd meeting. The idea is that we should have these standards in place as we continue to work on the city council amendments and any amendments in the future proposed by the city council or by our own proposals. These standards do not apply to citizen petitions where we have very little discretion for review. And so I would like to ask for a motion to recommend these standards with the explanatory notes to be forwarded to the Charter Commission meeting next week.
Yeah, I'll move that. This is Kozak.
Thank you. Yes.
Oh, I'll second Sandberg.
Okay, thank you.
If you're willing to change the title a bit.
Okay. Well, why don't you go ahead and then I can call on the other people who have indicated they'd like to speak.
Oh, my only concern, and it's not a big one, is that the title is Standards for Considering Proposals to Amend the City Charter. I think that it should include as proposed by the City Council or the Charter Commission.
Okay.
And make it very clear we're not addressing petitions in this document, because people just sometimes, they look at the header and that's it.
Okay, that's a good idea. It was in the first paragraph, but you're absolutely right. I think we could change that. Commissioner Schwartzkopf? Commissioner Schwartzkopf?
I got it now. Madam Chair, when I looked at this, I read number 11, which I think is very important. And then I read the beginning first paragraph, and I think there's a little bit of a conflict there. What I would suggest is that in the second line of the first paragraph, where we get the test should govern review, that we strike the word govern and insert the word be considered in the review. I think that will make it more comparable for number 11. And then in the next line down, we say the proposed amendment should pass all of these tests. I would strike all of these tests and insert those tests applicable to the amendment, and then continue on before the Charter Commission. So I think we should have those 2 amendments in there to comply with number 11.
Chair Clegg, since these are primarily the standards that you had suggested in the last couple of weeks, I would ask you how you feel about those proposed standards.
I would just like to remind everybody that we are not finalizing these. These will be finalized by the Charter Commission as a whole. So what I would suggest is that we just forward the items and then have a more robust discussion at the full Charter Commission.
Madam Chair, that's fine.
Sorry, Commissioner Schwartzkopf. I didn't hear what you said.
That is fine with me if we're going to have a discussion at the full Charter Commission and we just forward these, that's fine with me.
Okay, thank you. Commissioner Sandberg?
And that's fine with me also.
Okay. Any other comments or questions? If not, would the clerk please call the roll?
Commissioner Kozak,
Aye.
Commissioner Perry,
Aye.
Commissioner Sandberg,
Aye.
Commissioner Schwarzkopf,
Aye.
Chair Clegg,
Aye.
Commissioner Newborn,
Aye.
Commissioner Rubenstein.
Aye.
There are 7 ayes.
Thank you. That motion carries. And now we have a second matter, also under this agenda item. In the course of our discussions of the City Council amendment, again, a suggestion arose that we should form a second work group to look at the structure of government issues. While there's some arguable overlap with our work because of the proposed power shift that's contained in the City Council amendment, nevertheless, the structure of government is beyond the scope of this work group on public safety. So therefore, I would like to request a motion to recommend to the full commission, and again, this would be another interim recommendation from our work group, that a structure of government work group be formed. And so I would ask for a motion.
Motion Sandberg.
Is there a second?
A second. Schwarzkopf.
Thank you. And any discussion on the motion? Hearing none, I would ask the clerk to, for a roll call vote.
Commissioner Kozak,
Aye.
Commissioner Perry,
Aye.
Commissioner Sandberg,
Aye.
Commissioner Schwarzkopf,
Aye.
Chair Clegg,
Aye.
Commissioner Newborn,
Aye.
Commissioner Rubenstein.
Aye.
There are 7 ayes.
Thank you, Mr. Benjamin, and thank you all for keeping this discussion short because we want to move on to item 3, which is the greatest part of our agenda today, and that is the interviews of our invited guests to answer questions regarding the interrelation and coordination of public safety among the City of Minneapolis departments. Item 3.1 on the agenda is an interview with Mark Ruff, the city coordinator. And thank you very much, Mr. Ruff, for being here, as well as thanks to all of the rest of you who have joined us today. We have a series of questions for each of you, and then some general questions. So Commissioner Newborn and I thought we would start with the individual questions before we open it up to the work group for additional questions. And our first question to you, Mr. Ruff, has to do with something that keeps coming up in our discussions, and that is the current status of the 911 work group and also the Minneapolis Police Department staffing and efficiency studies, as well as the impetus behind these efforts and the desired or anticipated results or associated policy goals. And basically, we wondered what was going on with those studies.
Sure. Chair and Commissioners, this again is Mark Ruff. I am the city coordinator. I've been the city coordinator since approximately April of this year. Previous to that, I was the city's chief financial officer for approximately 4 years. Thank you for the opportunity to be with you and to talk specifically about these 2 important processes that are being undertaken currently and spearheaded by the coordinator's office, but in complete partnership with a variety of departments across the enterprise. You raised about the 911 work group, which is an endeavor that was started in 2019 and had significant input from MPD as well as our MECC, which is the responding agency for 911 calls, and coordinator's office and other departments. That 911 work group, which is still active after some break during the COVID disruption of our enterprise, has put out a request for proposals to look specifically at problem nature codes And problem nature codes are a specific data entry piece into our CAD system, our dispatch system that 911 operators input calls into actions by our various first responders. So that RFP is utilizing a consultant to look at the problem nature codes as well as our priority system. And that RFP, the request for proposals, responses are due in the middle of September. And we expect that work by a consultant to start in approximately November of this year, and will run for a substantial period of time. So it will take several months for the consultant to work through our specific system, understand it, and then bring expertise from their work in other places for how we want to make adjustments to our, essentially our call intake process and our data collection process. We feel that will greatly inform the next steps of the 911 work group. The problem nature codes is not the only part of the 911 work group, and certainly if you have more detailed questions at a subsequent meeting, I'd be happy to have other staff who are much more experts than me, but I will give it a high level. There were a number of other recommendations that came from the 911 work group, some of them around some efforts that were recommended by the mayor in the 2021 budget speech that just occurred a few days ago, and this is supported by council members as well, and that's shifting report production, especially theft reports, completely to 311, our other call center. So that will reduce the time necessary for a sworn officer to fill out those reports. And so that is an effort that came out of the 911 work group, which is being implemented at this time. There is also a program which has been initiated by MPD that is a mental health co-responder program that continues. That 911 work group did recommend an expansion of mental health co-responder efforts as well. And part of that expansion was also even looking at other first responders, such as the fire department, as embedding that more of a medical call than necessarily a public or law enforcement call. And as far as I know, there has not been action taken on that particular endeavor. But there were a number of ideas that if this group is interested in, I think that is also on the website, and I can certainly forward a request for a proposal, which also embeds links to the reports that were done publicly, as well as written reports, just a wealth of information around that area. The second area you asked about is the staffing and efficiency study.
Just a minute ago.
Sure.
I sent pictures to Jason.
I think there's an interruption here if you want to mute somebody.
I'll be working on that, Mark.
Thank you. The second area you mentioned was a staffing and efficiency study. The impetus for this again came in 2019. It brought together the staffing and efficiency study, a number of areas which were of interest to the mayor's office, to specific council members, as well as the police department, to look from a peer relationship, meaning what do other cities do in terms of staffing levels, not just around sworn officers, not just around patrol, but also in the various areas of MPD. The second impetus or reason for this study was and I think Chief Arredondo, when he was very involved in the planning for the study, said that essentially the police department has never, that he's aware of in the history of the police department, looked at a staffing study almost like a comprehensive plan for the police department, which is to say, instead of just year by year having a discussion about what is the appropriate number of sworn officers, to really try to tie those staffing levels to different indicators, and maybe enhancing not just the per capita indicator, but also looking at things that drive public safety needs within the city of Minneapolis. Much of that is around our entertainment venues, and the number of visitors that we have on a daily basis, the number of workers that we import on a daily basis when we are not in these pandemic times. There are other drivers in terms of the University of Minnesota that clearly drives some needs for response from Minneapolis Police Department. And so it was an attempt to try to then quantify then some of those drivers as to why we have demands on our public safety department and what that means forecasting wise, not just today, but in the future, about the different components of MPD. There was also some elements of that study that wanted to look at the use of overtime and what is an appropriate use of overtime. One of the council members, as you may be aware, and others have raised whether having patrols have one person or staffed by two people, is it appropriate in certain cases to have one person patrol? So that was an element of the staffing efficiency study. That request for proposals did go out. We did receive several responses. We had to delay because of the civil unrest, the consideration of those responses, but there have been interviews now conducted, and I expect that we will select a vendor within the next few weeks. And so that effort will also be undertaken. Again, not a short-term effort. We expect that that will go into 2020 before the results of that study are known. So that's an overview of those two areas.
That's great. Thank you very much. Second question is, does the city coordinator or your department have oversight of all public safety functions in the city other than the police department? And if so, what departments, functions, or programs are included in that oversight?
So, Madam Chair and Commissioners, I would submit, we first have to talk about the definition of public safety. And I think that is certainly something that could be a discussion more today if you want to, but I will make at least an attempt at least how I view your question and how it corresponds to the coordinators departments, and certainly be happy for clarification. I would say that a term that I would use first is maybe first responder elements of public safety, of which clearly the police department is one element of that. But I think traditionally, if you look at Department of Homeland Security or others, they will list first responders as being also fire department, emergency communications, which would include 911 response, certainly EMS, medical services, which, as you know, the city does not provide ambulance services. That's Hennepin Healthcare for the most part in the city. And also an element is emergency management. So those would be, I think, what you would typically see as first responders, again, in a non-pandemic kind of definition. The two areas of that fall into the coordinator's office are 911 response as well as emergency management. So those two departments do come and report through the city coordinator. There are obviously a number, if we broaden the definition of public safety, and I think Sasha Cotton, Director Cotton has given presentations, and I've listened to her and listened to others when she talks about violence prevention in the same way, that there are several departments across the enterprise which are involved in violence prevention and/or public safety. And I'll just list a few in addition to the fire department we've talked about. I think Public Works clearly has major public safety involvement. That is anything from they operate the fleet care for those first responders, so they take care of the vehicles. They oversee a number of the organizational efforts, such as the DID, the Downtown Improvement District, which has its own ambassador program and an element of public safety, as well as Public Works also oversees some of its own facilities security. And so that's an area. Regulatory Services with its traffic control efforts, its citations around housing violations or parking violations, its role in animal care and control. I think everyone would agree those are elements of public safety which are critical as well. The City Attorney's Office, in not just the execution of its partnership with law enforcement, but also its area of experimentation and incubation of different types of responses, is clearly a leader in the city around public safety, as well as our health department, where you'll hear more from Director Cotton about all of the efforts that go on through there. So I would submit that all across the enterprise, there's a variety of public safety elements. Specific within the coordinator's office, I will list a few more within our various departments that I consider to be public safety, and certainly we can have a discussion about that. I've mentioned 311. And the reports, they already have some function around taking some what we consider to be police reports for insurance purposes and entering those into the PIM system, and we're expanding that. I would say that a significant part of public safety is also our emergency radio system. So if you hear about like the 800 megahertz radio system that is run through our Finance and Property Services division, as well as much of the facilities and security for facilities is run through a security division within Finance and Property Services. The convention center is within the coordinator's office. Convention center, not only their building, and they oversee security for that, which has a significant public presence, but also manages the contract for the target center. Information technology, I think, is widely now seen as a security element, and our IT department reports up through the coordinator's office. Neighborhood and community relations, a separate department that deals directly with our various neighborhood groups and residents, has a long history of supporting public safety. And certainly within all of our human resources, within our lobbying folks, the intergovernmental relations, communications also have a very strong support role for public safety.
Thank you. That's extremely helpful and gives us a good broad overview of all these functions in the city. Does your office have any authority over the police department, such as civilian programs within that department?
Madam Chair and Commissioners, I am not aware of any formal authority that we have over the police department as the coordinator's office. The authority of the police department resides within the mayor.
And whether or not there are formal lines of authority, does your office collaborate with the police chief or his administration in setting priorities or in the allocation of resources? In other words, is there work sharing?
Sure. Madam Chair and Commissioners, every department within the city is involved in work sharing. As you're all aware, this is a shared power organization, and departments support each other in many ways. I will try to list off a few examples of the collaborative efforts, and I again want to applaud Chief Arredondo and his staff, who are a very collaborative group of folks, and really am grateful for the relationship we have with the police department as city coordinator and in my previous role as CFO. The specific collaborations when we talk about allocation of resources, obviously the budget process is a significant part of the process. The budget process is run through our budget office, which reports up through the coordinator's office and works very closely with the mayor's office. Within human resources is our labor contract negotiations staff. And so when it comes to setting contract terms with the various labor groups, HR works hand in hand with the chief and his staff. The collaboration around planning for large events, when we think about whether it's something as large as the Super Bowl or Final Four, or whether it's any kind of significant public event within the city, there's strong collaboration among the department and the city coordinator's department. With our work with emergency management, crisis management clearly is an area where there's an awful lot of collaboration that goes on, and me personally with the chief, and the chief is always receptive to my texts and phone calls. I would say that we also collaborate very much in working with other jurisdictions, whether that be Hennepin County or the state of Minnesota, whether that be the park board or the school district. There are constant discussions going on in those types of intergovernmental work, not the least of which is, as I mentioned before, lobbying at the state capitol for efforts where the mayor and or police department wants to see specific changes, as well as their city council. So those are the primary areas that I would identify as collaborative efforts around priorities and resources.
Thank you. Do you have, it already sounds good, but do you have any suggestions for ways to improve any work sharing or coordination?
any organization can improve. The city of Minneapolis, in addition to being a shared power organization, is a relationship-based organization, and I have seen great improvement already in just the individual relationships among various staff in MPD and different parts of the city coordinator's office. So that is my main suggestion, is that interaction, which I coach all of our newer employees to spend the time building those relationships, is the most important thing that we can be doing to support each other, to build trust. But beyond that, there are certain structural issues that really I don't think are probably necessary to go into right now. But I heard you talk a little bit more about governance earlier on in this conversation. There's, as I said, always improvement, but I think it starts with the people and the relationships among the people.
Thank you. Were you involved or consulted in the development of the proposal for creating a community safety and violence prevention department, which was part of the city council's proposed amendment, which would bridge police and other functions? And have you been engaged in any planning or initial work with respect to the possible creation of a new department?
So the two questions, Madam Chair and Commissioners. One is, I was not involved in the drafting of the document, if that's what the question is, related to the council efforts. That was a council-led effort, and was not asked to participate in that. When that resolution was passed, as with any major endeavor within either the council or the mayor's office, we as coordinators office always offer staff to help in those processes. I do have two coordinator staff who are working closely with the work group, and they are supporting that work on a day-to-day basis. And then we, I'm sure, as you have heard, if you have been watching some of the council presentations, there is an engagement process that is a component of that work group. That engagement process will certainly be supported by communications, by neighborhood community relations, in addition to the staff that are working on the core team with council.
Thank you. With respect to 911 operations, are there reliable or typical industry standards or indicators to determine if police presence or police intervention might not be necessary to respond to certain of 911 calls or calls for which other non-licensed, non-law personnel could respond instead?
I think the short answer that I can give you about this is no, there is no industry standard across the country. The longer answer is, as I mentioned earlier, there were some great ideas that came out of the 911 work group. I think that everyone from our director of MECC to our coordinator staff to MPD to even as we talk through with our other partner jurisdictions recognize that there is room for improvement in this area. But it would be a course that would need to be charted, as we have been already starting to do and will continue to do within our jurisdiction. Every public safety organization across the country is formulated a little differently. As I talked about earlier, we have certain things that we do as a city and certain things that other jurisdictions do. And so we don't have complete control. For example, if we wanted to rely more on EMS, we don't have control over those things. And so that takes a cooperative effort and would need to involve other jurisdictions in certain cases.
Thank you. We will have some more general questions for you later, and some of the work group may also have questions, but I want to thank you for answering all these initial questions.
Absolutely.
Thank you. We wanted to turn now to Commissioner Musican and Sasha Cotton. And I turned to Commissioner Newborn first because I was going to ask these questions, but since my computer isn't working so well, I wonder if I could ask you
to ask those questions instead.
Of course, of course. Director Cotton, it's good to see you, and thank you so much for coming. And we have a few questions that I think were provided to you in advance, and I'll just dive right into it. Please describe the partnership, roles, and responsibilities that the Health Department, including OVP, has in conjunction with MPD and other public safety agencies in terms of the broader concept of community safety and violence prevention. A second part of this question is describe the department's vision for its future role, potential collaborations, and what governance framework would help to advance or prevent that work from advancing.
Good
Loaded
afternoon.
question.
Sorry.
No,
Good
sorry.
afternoon, Commissioner Newborn and other commissioners. Chair, thank you so much for having us. I am joined by Commissioner Musicant, and I know that our plan is to tag team this presentation a bit. So I think that, Commissioner, you would plan to give some context on this question, and then I'll jump in as well.
Great. I apologize, Director Musicant, for overlooking you as well. Thank you for being here.
Thank you, Commissioner, and thank you, Sasha, for turning it over briefly to me. So I just thought I'd give you a little bit of context of the Health Department's formal entrance into violence as a public health issue. Back in 2006, we really began to see a role, the City Council began to see a role for the Health Department to look at violence prevention. And by 2008, the City Council had passed a resolution defining public health issue. And from there, we worked with the community, developed a blueprint for action, really laying out the scope of the types of prevention that could be engaged in. And that has been updated at least once since then. We've had advisory committees to help us implement that work. I'm going to let Sasha talk more about the Office of Violence City Council action, and really has been up and running for just about 1 year. To give it some organizational structure to build on what had been our youth violence prevention, more a larger role within the health department, to make a division out of the health department, which it is. Other ways, I'm going to talk about a few other ways outside of the Office of Violence Prevention that we have worked with the police department, and then turn it over to Sasha to talk about the very robust work we're doing inside the Office of Violence Prevention. So we have worked on the opioids issue quite a bit in the community, hand in glove with the police department. Have also entered into an arrangement where we did a mortality review. So looking through the eyes of police data, as well as data from others that might have touched the lives of people who died because of the opioids. That was really a new kind of collaborative engagement using data and thinking together about what the meaning was there. We've also worked very closely with the police department addressing issues related to unsheltered homeless people. Another public safety we have worked on is through the Youth Coordinating Board, which is a multi-jurisdictional group that has elected leaders from the county, the city, the parks, and the schools. And they have community outreach teams that are serving both downtown and some of the northern parts of the city that have been very successful in redirecting young people and cutting back on violence. I am also a co-sponsor, a process owner rather, with the police chief on a public safety priority of the city's strategic and racial equity planning effort. And so we are regarded as partners there in trying to make progress on that public safety priority. I'll turn it over to Sasha to talk about the Office of Violence Prevention.
Well, good afternoon again, everyone. Thank you all so much for the opportunity to be here. Thank you, Commissioner Musicant, for that background information. There are a number of ways that the Office of Violence Prevention works with MPD as well as other law enforcement entities, across the area. And so I think I'll give some background on a couple of them, and then I'll spend some time talking specifically about our group violence intervention, which I think is our most comprehensive way in which we partner with MPD. First and foremost, our Office of Violence Prevention Executive Committee is chaired by our mayor and our police chief, along with a representative from the Minneapolis Foundation. And so we get a lot of value out of that relationship and having the chief as a part of that body and helping to steer the work in that role, which has really been wonderful. Prior to that, we've always had representation on our steering committee from MPD, but having him as a co-chair has really been quite helpful, and I think has been a unique add. In addition to that, our Office of Violence Prevention includes the work of the Juvenile Supervision Center, which is a non-detainable location for youth to be brought in for low-level offenses. It's housed in City Hall, and MPD officers are, and other officers, but mostly MPD officers are the ones who are bringing those youth in to the Juvenile Supervision Center. So in addition to the relationship they have via contract with the staff who manage that Juvenile Supervision Center, we are in relationship on a work group and an executive committee for the Juvenile Supervision Center with staff from MPD. So there's quite a bit of co-work that happens through that body of work as well with juvenile. And additionally, we do quite a bit of work with them through diversion. So MPD does have a diversion program, and we're able to participate both by work group and by the planning process of trying to come up with the best strategies around diversion for our young people who have low-level offenses and really may benefit from programming versus pure enforcement strategies. And so those are some of the more juvenile-focused ways that we're involved with MPD. Some of the other ways that we partner are through bodies of work group and leadership task force. Our multi-jurisdictional team, which is focused on youth violence as well, we brought it over from our previous work. We do have representation from juvenile command staff at that meeting, as well as having what used to be the representative focused on the school resource officers teams. So that person is no longer attending, seeing as how we don't have school resource officers at this moment, but they were a really valuable add and continue to be very valuable to that conversation around keeping young people safe and working collaboratively through the various jurisdictions in the city, the county, and the state in keeping our young people safe. And MPD is a critical partner at that table. In addition, we have our community trauma response efforts, which we've had work with MPD on the planning phases of, looking at ways that community can respond better to shootings and other traumatic incidents. MPD has been a core player in the layout of that and helping to develop key communication strategies on how the Office of Violence Prevention can receive information about shootings so that we can develop strategies to respond with community protocols. And I think the last item that I'd like to lift up is our group violence intervention. The group violence intervention is a three-pronged approach that looks at reducing shootings, and particularly shootings involving group and gang members. That initiative started in late 2016 and has been a very, very deep dive in partnership between what is now the Office of Violence Prevention and MPD. I see Deputy Chief Forrest here on my screen, and I can't help but see my partner. We do a lot of work together in the sense that we're meeting sometimes 3 to 4 times a week, working out data and identifying ways to keep communities safe, identifying those who are at greatest risk for being a victim or a perpetrator of shooting based on police data, as well as hosting several meetings together, both the shoot review, so we review every shooting in the city, as well, and I'm sure that the Deputy Chief will talk a little bit about this in his report as well, so I don't want to steal his thunder. But in addition, we have an executive committee that is chaired by our mayor. Our chief is also a part of that. Our United States Attorney's Office, our city attorney, our county probation department as well, and our United States Attorney's Office are all a part of that. And so it really is a collaborative effort looking at both the Office of Violence Prevention and non-enforcement strategies, as well as our partners in enforcement and how we can bring about community safety. And so those are just some examples of how we work on a regular basis with our partners in MPD.
Great. Thank you so much, Commissioner Musicant and Director Cotton. We appreciate your response. I'm going to go move to the next question. Please share examples of policy level initiatives or programs that the health department, including OVP, have put in place or have planned that address alternatives to traditional law enforcement in the broader concept of community safety and violence prevention.
Commissioner Musicant, I'll jump in here if that's okay. In public health, we think about our work as a couple of different tiers. We think of primary prevention as really being addressing the root causes of violence, things like poor educational outcomes and communities where violence might be prevalent, ensuring that young people have adequate access to mentorship and healthy families. Really what can keep communities healthy, happy, and hopeful are often what we think of as primary prevention. And we have a number of programs like that. We also have intervention-based programs that look at high-risk populations and are trying to address those risk factors before they turn into violence or high levels of violence. And the last piece of our work is what we consider to be tertiary work, and that is really response-based work or work that's looking at the ongoing cycles of violence and what we can do to prevent the repeat nature of retaliatory violence in particular. And we have a couple of programs that fall into that arena. I talked a little bit about the group violence intervention, which is really focused on interrupting the patterns of group violence and responding to shootings and doing what we can to prevent the retaliatory nature in partnership with MPD and probation in particular of violence. And so what that often looks like is a methodology called custom notifications. So that is our staff and contractors, as well as MPD, having one-on-one conversations and meetings with those involved in shootings or those who we think are high likelihood for participating in a shooting, and giving them a strong and confirming message that we want them to be safe, alive, and free, but that the violence won't be tolerated and that there are resources to help them, but that the law enforcement partnership will hold them accountable if they perpetrate acts of violence. And so, again, that's not in any way to replace the work of MPD, but we do think that the partnership really does have added benefit and brings forth a level of procedural justice and transparency that has been really welcomed by community. The other program that I think falls into this venue is our hospital-based work. We currently have response teams at both North Memorial Hospital and HCMC Hospital. When anyone who comes in with a serious gunshot wound, stabbing injury, or other serious assault from violence receives an immediate bedside intervention and services. And so there may be information that they're unwilling to share with law enforcement, but that they're able to share with staff from our hospital-based program. We're also able to provide long-term wraparound services, as well as basic needs that aren't often met without these kinds of programs. And so those are some of the response-based work that we're doing that really add to both a decrease in retaliatory violence and a meeting of the needs of people immediately after an incident with violence. Commissioner, I don't know if you had other things you'd like to add. Commissioner Musicant, I'm sorry, there's so many commissioners.
Thank you. I was just wondering, Sasha, if you wanted to, or maybe you're going to talk about this a little bit later, talk about sort of the emerging work that we're doing that the City Council has only recently allocated some funding for.
Yes, I was intending to maybe hold that over, but I'm happy to talk a little bit about it now. We are replicating a national model that's a best practice around reducing retaliatory violence and interrupting the cycle of shootings. That's called Cure Violence. It is a model that's being replicated across the country and has been known to reduce shootings of up to around 40% when implemented with fidelity. And what it looks at is a wide range of outreach and engagement strategies, really focused on those communities hardest hit by group and gang violence, and using people who have their own past and lived experiences in groups or growing up in communities where group violence was prevalent to do violence interruption, quite literally. So interrupting those patterns of violence by de-escalating the conflicts, getting to conflict resolution with the parties involved in shootings, and bridging the gap. And we know that sometimes people who are from communities where violence is prevalent, who know those communities, know those streets, they have a way of persuading people and compelling them to de-escalate in ways that others of us in government might not be able to compel them. And so we're really excited about the build out of this work. We're in the planning phases right now. We're actually showing the film The Interrupter this evening at the intersection of Lake and Chicago, because we want to introduce the community to this concept of using civilians who are completely unarmed, but who are armed with training around de-escalation and conflict resolution, as well as their lived experience in community to help de-escalate the ongoing conflicts that we know are often small in nature, but can erupt into real violence in community when they're unresolved. So we're looking at having somewhere between 70 and 85 people working in various neighborhoods throughout the community by the end of this year.
That's great. And so that may get to the question, the next question. And so I'll ask it, and if you've already answered it with this additional work that you're doing, feel free to skip it. But please provide information about public safety reforms that the health department, including OVP, anticipates in the near term based on efforts or initiatives in comparable jurisdictions.
So yeah, I think that is definitely one of the major highlights, Commissioner. Thank you for the question. The Cure Violence Like model, and really ensuring that we have boots on the ground engagement with the folks that we know are most likely to be involved with the violence. But in addition to that, we are also looking at work specific to intimate partner violence and doing some audit work that's been done in other jurisdictions to get a better understanding. Right now, the coding for domestic violence is pretty universal. And so we catch things in our coding that are not intimate partner violence that get coded as domestics. For example, conflict between a roommate or conflict between a mother and a son might get coded as a domestic. But thinking about treatment, which is the way we talk about it in public health, we need to know the nuance of what's happening, whether it's family violence or intimate partner violence or child abuse. We really need to know those differences. And so we're working with John Jay College out of New York as a technical assistance expert to help us both look at some of those codes, as well as come up with some solutions that might better address particularly intimate partner violence, because we know the alarming rate at which it impacts community violence, as well as how detrimental the exposure to violence can be on young people in the home.
Maybe I'll just add to that Sasha mentioned John Jay College. We are also longstanding connection to Cities United and the Prevention Institute, which are national organizations which really help us understand what is being tried and what is being tested and what is working in other communities. And under the Obama administration, there were also efforts that were organized by the Office of Justice that helped us do the very same thing. So we try to be in touch with what's going on and reinforce our own work by what's learned elsewhere, and then share the work that's going on here with them as well.
Absolutely. Thank you for that.
Next question, and maybe final question. Well, maybe two more questions. In comparable jurisdictions in the work that you've done, could you talk a bit about, their success at driving police accountability, meaningful citizen oversight, and in similar matters?
Sure. I think that some of the cities that actually we've met that are doing some of the best work have been cities we've met through the National Initiative on Building Trust and Justice. One of them that we would point to, which is actually an initiative out of the police department, the group violence intervention is actually a byproduct of that work. And it really does focus on transparency and building trust and procedural justice between community and law enforcement. One of the cities that we've spent a lot of time partnering with and learning from has been Stockton. I think many cities across the country now are having to take a hard look at where we focus and how we can direct our efforts in a concentrated way. And Stockton had a little bit of a jump on us in that back, I think around 2013, their city filed for bankruptcy, and they really had to tighten their belts and think hard about what were the priorities as a city that they could focus on. And they really landed on looking very specifically and intentionally at the group violence dynamic as a way of being very transparent and forthcoming about how their city could focus on violence that was really impacting residents in a way that was troubling and disturbing, and through some very specific strategies in their national initiative and their GBI work, I think they've seen real growth around community police relationships and procedural justice. And so Stockton is certainly one of the models that we look to. They also have an Office of Violence Prevention. And I think the way that their Office of Violence Prevention and police department work together has also been a really good example of work that we want to build on here in Minneapolis.
And now moving to our final question. In light of current budget crisis arising from the health pandemic and George Floyd's death, have funds for any specific service or programs been identified for cuts? Is the first question. Which specific services or programs related to public safety? And then finally, given that potential, what will be possible going forward with respect to reform and the pursuit of alternatives to traditional law enforcement and violence prevention?
And Commissioner Musican, I believe you're going to talk budget.
Yeah, I am. Thank you, Sasha. So let me just give you a little bit of context. The base budget for the Office of Violence Prevention is $1.7 million. And there was an infusion by the City Council to help us create the Cure Violence this year. And so that would bring it up to $2.8 million. Over the course since 2006, we've had a variety of different types of funding. We've used community development block grant dollars. We've had a growing investment of general fund dollars. We've gotten competitive grants. We've gotten the federal level, at the state level, private sector. And through that all, I think we developed a lot of good and promising initiatives, but we have never really taken anything to full scale. So we're growing, trying, showing impact. In the particular budget situation we find ourselves in right now in the city, violence prevention efforts in the health department have been spared from cuts. So we will not be recommending cuts in 2021 for that budget, and the budget that was approved by the City Council to modify the 2020 budget did not impact the work of violence prevention either. That's all the prognostication I can do on budget for you.
Commissioner, we appreciate that. We know how tricky that is during this time of year. Those are all the questions that we have for your department, Commissioner Musican and Director Cotton. Thank you so much for coming in. As was stated earlier, we may have some of our commissioners here, charter commissioners may have some questions towards the end, but we're going to move to our next speaker, and Commissioner Rubenstein is going to introduce them.
Okay, thank you. Our next speaker is the Director of the Office of Police Conduct Review, Imani Jafar, and thank you as well for being here. We very much appreciate it. We had, I hope, just a couple of initial questions. The first is, please update us on current efforts or initiatives by the Office of Police Conduct Review and the Police Conduct Oversight Commission, which I get you staff, on the broader topic of public safety and its work to provide an outside independent check on the Minneapolis Police Department.
Chair Rubenstein, Commissioners, good evening. The first thing I'm going to do before I answer that question is I, in addition to my job here, actually do a lot of diversity training around working with Muslim Americans because I am one. My name is spelled wrong on the agenda. I know it's not a common name, but I've noticed it's okay. It's not a problem. I've just noticed in a couple city documents my name has started to show up misspelled, and I would not put into practice what I teach people if I did not correct that. So it's actually JAAFAR. So no, I just, yeah, thank you very much. I'm sure it can be easily corrected.
Our deep apologies.
No, it's my pleasure to be here. So I'll start with your first question. So I actually think what might be helpful is for me to give you an actual overview of how we do police accountability in the Office of Police Conduct Review. For those of you who are unfamiliar, we are actually housed in the Civil Rights Department. We are what's called a hybrid oversight model, which means that we have staff within the Civil Rights Department who are civilians from all different backgrounds, and then we work with the Internal Affairs Department of the Police Department. And so there's really two major functions as to how the Office of Police Conduct Review does its work. So the first kind of vein of work I'll start with is the receiving complaints both from internally from the city, and that includes the police department, but mostly externally from the public. And so that's a really important function of what we do. So the public can file complaints multiple ways. By far, the most common way to file a complaint is online. We actually get those complaints. Those are then processed by an intake investigator in our office. She comes from a social work and criminology background. And so she will screen all those complaints and gather whatever evidence is available. That includes whatever the complainants provide us. If they have, iPhone video, emails, things like that. We also have our own direct database access to all of the Minneapolis Police Department databases. And I'll talk a little bit more about that when you ask me in the second question. But we do our own investigation to pull all of that together just to get a preliminary look at the case. Then that case comes in front of what's called the Joint Supervisors. The Joint Supervisors is myself as the director of the Office of Police Conduct Review and the commander of the Internal Affairs Division of MPD. So we sit in a room once a week and we screen cases together. We have to agree on the track of those cases. If we don't agree on the track of those cases, then it will escalate up to the director of the Civil Rights Department, which is Director Velma Corbel, and the chief of police. If that is unable to be resolved, then it escalates up to the mayor. We have a lot of spirited discussion, as you could imagine, in our case processing, but really our job is to kind of decide what cases go forward to investigation and what are cases that can go other routes, such as mediation as an option. Sometimes we refer people to training. So there's multiple routes that a case can go in that. So cases that go forward all the way to investigation, those get assigned and the public has a choice if they'd like a civilian or a sworn investigator. We have 2 case investigators on staff. They have both worked with the office for a substantial amount of time, and those investigators are Civil Rights Department employees. So they will take those cases and do a full investigation, and they'll use all of those things that we looked at the beginning of the investigation and even do a deeper dive into the material. So then when they do that, then that investigation is actually done in a neutral way with no opinions. Our office prides itself on being a neutral fact finder. So not unlike the court system, we're putting something together where it's going to go to a small jury, which is our review panel, for a decision. So that the job of the Joint Supervisors is to kind of guide that case through the system to make sure it's complete. It has all the information. That includes interviews with officers. It includes interviews with the public, people who submitted the complaint, people who might have been witnesses to the incident, and they do a very complete look at that. When that's completed, it goes to that small panel. This is the other part where there's more layers of civilian oversight in that panel. So there are people, citizens who volunteer their time. They have to be residents of Minneapolis. They are appointed by the city council and the mayor, and they actually apply for those positions. And they sit with 2 sworn, now it's going to be commanders and inspectors. In the past, it was lieutenants. And they sit in a room together, and their goal in that room is to decide whether the case has merit or no merit. For those of you who might be familiar with the legal background, I'm a lawyer by training myself. That's a preponderance of the evidence. That's one of the lower standards. So it just means, is there more than a 50% chance that the incident that comes forward actually happened? They can only decide if a case has merit. And that is actually related to state law. That's Minnesota Statute 626.89 Subdivision 17 that says civilian oversight bodies cannot recommend discipline. So they are very specific. Now, they don't all have to agree, and we get cases that are split in two. We get cases where 3 people think there's merit, 1 thinks there's no merit. We get cases in the reverse, 2 merit, 2 no merit. Whatever the outcome is, that case then leaves our office and then goes to, it goes through some due process pieces for officers and then eventually ends up with the chief of police. But once that review panel is completed, our office's work on that case is essentially completed. So you can see one thing that's unique about Minneapolis is that kind of layered approach to civilian oversight. Another really unique piece is having direct data access. That's something that a lot of cities don't have, and I can talk about that later. The second prong is really related to kind of high-level research work, and how we go about that is in 2 different ways. One way that we go about it is that we help staff a public-facing commission, the Police Conduct Oversight Commission. That commission, through a variety of methods, doing their own individual look at cases that came out of the OPCR, but also just their working community, because just like the review panel members, they apply for the positions, they interview for the positions, and they're appointed by the city council and the mayor. So they also look at issues on policing. So I'll give you an illustrative example about how this process works. The commission a few years ago was really interested in seeing mental health response. They were concerned that MPD might not be doing everything it needed to do when they were responding to calls that involved people with mental illness. So what ended up happening was that there was an advocate who actually showed up at a commission meeting, because we take public comment at the commission meetings. That individual said, I think this is something you should look at. The commission said, yeah, we'd really like to look at it. So once they go through a formal approval process saying we want to examine this issue, the Office of Police Conduct Review as staff, that includes myself, will start to take an analytical look at the issue. And usually how we approach it is to pull data, and that's a nice thing for us that we have the direct data access. So we'll pull and analyze our own data. We'll interview experts in the field. We will reach out to people who may be doing similar work to try and get some different perspectives. We'll reach out to people who've been affected by the issue. So if there's people in the community who are willing to talk to us who said, I'm a person who has a mental health problem, I had a negative or positive interaction with the police, we'll look at all of those things, because I think a hallmark of our office is the idea of coming forward to things with an air of neutrality and using data to back up anything that happens. The end result of that is we'll put recommendations for the police department that then we work directly with them. So what was born out of that study I mentioned was actually the mental health co-responder program. And we helped put that together with the police department. The police department has been really responsive to the Police Conduct Oversight Commission studies, and there's been a lot of positive change. We did one on housing and evictions, how police calls for service were leading to evictions. There was an ordinance change as a result of that study. And the domestic violence response study that we did, there's currently a work group now, and they've made some really positive changes about how the police interact with domestic violence victims. So that's one way. There's another vein, and that's called research and study, that process. There is another vein called a programmatic audit, where we worked on our ordinance in 2017, and in enhancing that ordinance primarily with Councilmember Palmisano, but the Public Safety Committee at that time as a group, was to build in the idea that if we saw an issue that needed to be addressed, we could launch our own audit into it. And so we have that capability too. An example of that audit is the police use of sedatives during arrests. That was something that was spotted on a routine body camera audit for internal audit. We then saw that, went through the proper channels to have Director Corporal approve going forward with an audit, and MPD actually responded by immediately making sure that the language was incredibly clear about not making medical decisions while during arrest. So those are some examples of how we work on accountability, but it's really 2 very different functions, working on whether it's a research and study and audit, and then the day-to-day casework. And just for, kind of a bigger idea, we work on about 600 cases a year. And we have about a staff of 6 people, and internal affairs is usually staffed somewhere between 7 to 9 people.
Wow. So thank you. That gives us a very clear view of the work you're doing, which is just amazing.
Thank you.
So I think that you've answered the first question about current efforts and initiatives, and we appreciate that. The other question is, maybe you've also already answered it, at least in part, which is to please share examples of any policy level initiatives or programs in comparable jurisdictions that have been successful at driving police accountability, meaningful citizen oversight, and similar matters.
So Minneapolis is actually, we are a member as the Office of Police Conduct Review of the National Association for Civilian Oversight of Law Enforcement. They're called NACOL. And that is a group of civilian oversight from all across the country who stay in touch with each other to kind of share what they're doing. And we have a conference. I've gone to the conference every year except for this year because of COVID. But I also do regular one-on-one calls with the president of NACOL, Susan Hudson, who works out of Louisiana. And, you know, I think what's so difficult about this question for me is that what you'll find when you go nationwide is that every oversight model is so specifically tailored to the city that they're working in. And one thing that sets us apart, like I mentioned before with the data access, if any of you have been on our website, you may have used the tool that is the public data portal. Our office actually built that tool so the public can have direct access to not only officer records, but see how we were making decisions. I mean, I was very insistent that we had a tab that showed how the joint supervisors made decisions on cases. That is unique in the nation. And when I go to those conferences and talk with other practitioners, they are jaws on the floor with how much direct access we have to data. I mean, the Minneapolis Police Department has worked with us to make sure anytime we get new staff, they have access as quickly as possible. And that's, I think, something that has been a good trust building exercise between the two of us. But we have a lot of access that other people don't. So a lot of the things I hear when I'm in national company is, gosh, I just can't get a police report. I would just kill to get that body camera footage. That's not the problem that we're dealing with. And within that group last year, we actually got a national award for our auditing work from NACOL itself. So I think, you know, my takeaway from this when you're looking at the work of civilian oversight in Minneapolis is you have a lot of good foundational work here. Can you always take enhancement and supports? Absolutely. But you do have something that I can tell you from just keeping in regular touch with a lot of other professionals across the country that they are trying so hard to build that in their cities, and Minneapolis has it.
Thank you very much. We have only about 20 minutes left, and we greatly appreciate all this information. We wanted to ask a general question of all of you, and we also want to leave time to open this up to other members of the work group if they have questions. So maybe we should start with the members of the work group and whether you have additional questions. I think you did too good a job. Thank you. Oh, here, Commissioner Schwarzkopf.
I have a question, and that is the work that you do. I'm talking now with the last speaker. The work you do with the Civil Rights Department, is that the same thing as the Police Conduct Oversight Commission, or is that something different?
Chair Rubenstein, Commissioner Schwarzkopf, it is actually something different. We do staff that commission, but they are an independent body because they are people who are citizens who are appointed into those positions. They do operate independently. So those evening meetings that they have that you might see or work that they actually have one that I'll be going to tonight as soon as I'm done with this meeting. But they are an independent body, but we do support them. They are volunteers. So for them to be able to write, you know, we're not expecting them to write like a large research project on how to help people with mental health. You know, we do that for them, but they are a separate body.
And do they meet monthly or what?
They do meet monthly. They meet at the second Tuesday of every month from 6:15 to about 8:15. They also currently have subcommittee meetings that occur about once a month. So they're meeting right now, I think, about 4 to 6 times a month, depending on the subcommittee schedule.
So do they bring also suggestions or questions about police conduct to you too, or what?
So how how it works for them to refer an issue to us is they actually will do it formally in a meeting so that we're making sure that we're following open meeting law, but our staff attends those meetings, but we don't, we're not an active participant. That's kind of their space to have their meeting. But when they're ready, so for example, one of the issues we're working on right now involves the Trans Equity Council, and they brought an issue about hate crimes not being reported against trans community. And so that was an issue that they brought to the commission, saying that, LGBTQ community, trans community, this is a huge concern. We don't feel like they're being treated appropriately by the police because they can't get police reports. So they made a public presentation. The commission said, yes, that's something we'd like to work on. And now that issue has then referred back to our office, where we have data analysts who are working directly on that issue to look at, okay, what can we find? Do we see that there's not reporting? And then reach out to all the relevant parties, including advocacy groups that work in the trans community especially, and the Trans Equity Council will help us refer to the right groups. We'll also talk with people in MPD who work on those issues. So we really do try and stay in that neutral space so that we can get kind of the most participation and talk with people in a safe space for everybody, so we can get a good hold on the issue. Then we can make recommendations about how to go forward. And then we present that report when it's done. We present that report back to usually both the PCOC, and when there was the Public Safety Committee, obviously the pandemic is making things different. We would also present those reports to the Public Safety Committee of the City Council, because that's our home committee. So you can look, I've done presentations on the housing work, domestic violence work, sedatives work, like that is all actually publicly available online, those presentations that we've done in the past, but we also do them for the PCOC.
Thank you.
Thank you. Commissioner Perry?
Thank you, Madam Chair. I think this is for Mr. Ruff. It's a question about the Office of Innovation. I'm wondering if he can speak to who they are and what role they have in public safety in the city of Minneapolis.
Sure, Madam Chair, Commissioner Perry, the Office of Innovation, led by Brian Smith, it is a part of the coordinator's office, and they have been in the past funded in part by a Bloomberg grant, and so follow very much some of the methodologies that are promoted by the Bloomberg Foundation. And that includes, as a part of innovation, certainly, and we alluded to this with the 911 work group, data-driven analysis, pilot programs and testing of various alternatives, and then coming back with solutions. And so that's not just around public safety, but other initiatives that they have undertaken that predate me as a coordinator. But it's a team. They also help staff Results Minneapolis, which is a longtime program of essentially program evaluation within different departments. And so they're a very active group.
Thank you.
I have another question of a different visitor, if I may. Madam Chair?
Certainly, go ahead.
This is for Commissioner Musicant. It was reported in the paper when the amendment that came from the council was first talked about, that someone from the health department had been identified as a possible leader of the new charter department. I don't know if you remember reading that or not, but that was what I read in the paper. And so what I'm sort of interested in is not necessarily knowing who that might be, but what kind of characteristics they might have to be able to lead that department if they were to come out of the public health department.
Well, that's a very interesting question, and I must confess I haven't thought deeply about just exactly what characteristics, because I don't know that much about what this new department might actually look like or be. I might take this time, though, to say that taking a preventive approach, even a tertiary preventive approach, as Sasha Cotton described in the work that's Cure Violence, takes a certain set of operating principles of how you invest in something now to gain something later. And when we are in a crisis and when we respond to a crisis, it's very difficult for us to simultaneously invest in prevention. And so I do think there are great challenges at combining prevention and response into the same cultural department. So that would just be an offhand observation, but I don't know that I have enough information to answer your direct question. I'm sorry.
Okay, thanks.
Any other questions? Good. Thank you all. Because we did have some more general questions that we wanted to ask the group of you who are here, and I don't think we have time for them, but what we'd like to do is ask you if we might send those to you after this meeting, because they are more directly related to the charter and the language of the charter. And so rather than try to start that now, we will perhaps follow up with your permission. And instead, we all want to thank you again so much for this valuable information. And I'm going to turn it over to Commissioner Newborn for the last item on the, well, first also, I wanted to recognize Deputy Chief Force, who's been sitting in on this meeting, and to thank him as before for being here, and to acknowledge the wealth of documentary and information we've just received from you, and we'll be talking more about that probably at our next meeting. So thank you for that.
You are most welcome, and if anyone has any questions, please feel free to reach out.
Thank you. And I turn it over to Commissioner Newborn for our last brief item on the agenda.
Yes, thank you so much, Commissioner Rubenstein. And thank you to our speakers here today. We really appreciate it. We know that we had a laundry list of questions, and you all pushed through and provided us with some really insightful information about your respective departments and how they connect with public safety and law enforcement. The next item on our agenda is next steps. And we don't have much to say other than we have a meeting. We will be scheduling a meeting, weekly meeting for next week, I believe next Tuesday at 4:30. And we will have a list of speakers at that meeting as well. Please take a look at the agenda. I'm sorry, not the agenda, the work plan that was discussed earlier to highlight that. If you have some questions that you would like for us to add to ask of the speakers, please send those over our way. And with that, unless Commissioner Rubenstein, you want to make any additions, we can adjourn the meeting.
I think we can do that.
I have a question.
Okay.
Yes.
So I'd love to have the opportunity to submit questions if it makes sense. Can two things happen? Can we get the list of speakers who are going to be invited to the next meeting earlier than later? And also, can we have something set up that maybe it's done through, I don't know how the city IT guys would do this, but to see a running list of questions that have already been developed so that we're not, potentially repeating questions that we're thinking about. So those are my two comments and or questions and requests there.
Great. Go ahead, Commissioner Rubenstein.
I was just going to say thank you. Those questions are well taken, and we get followed.
Great. Commissioner Schwarzkopf?
I too would like to know if there's a chance for us to ask some questions when a person makes a presentation. I had 3 or 4 questions I'd like to ask different people, but our time is short apparently, and so therefore we can't do that. But it would be good if we could follow up with questions right after they make a presentation. I just suggest that as an idea. Thanks.
Great. Thank you so much, Commissioner. Duly noted. Any other questions? Okay, see none, then we will officially adjourn the meeting. See you all next week and have a good night.
Thank you.
Thank you.
Bye-bye.
Thank you, right.
Thanks to everybody. Andrea, I'll send you something about email, about your computer.